Good morning, everyone. This is Mrs. Rajalakshmi Murthy. So, from this video, we are going to discuss about what is meant by APGAR score, why we need APGAR score, then who is the founder of APGAR score, then how to assess the APGAR score. So, that things only we are going to discuss. Next, please. So, next one is we can see who is the founder of APGAR score. So APGAR score is invented by Dr. Virginia APGAR in the year of 1952. This APGAR score, which is used in many countries around the world, even it is useful for the doctors to help the quality assess to health of the newborns to determine if they need any medical interventions soon after the delivery. See, the APGAR score is help to decrease infant mortality to a great degree. See, soon after delivery, if the baby is having any congenital anomaly, any deformities, or the baby need any medical interventions, so all the things to how to assess based on this APGAR score. This APGAR score is not predicting the future of the newborn. It is assessing the soon after delivery to assess the baby's health conditions. Next, please. So, next we can see the APGAR score. In APGAR score, there is a 5 components will be there. The first one is appearance, second one is pulse, third one is grimace, fourth one is activity, then fifth one is respiratory effort. So here they have mentioned here the first one is appearance. Appearance means that is the color of the baby. The second one is pulse, that is the heart rate. Then grimace means reflex, irritability means suppose if we do anything on the baby's body, so automatically the baby get to react. So that things we can call it as grimace. Then activity, in that we are going to check only the muscle tone of the baby. So how it is flexing his leg, even we are pulling the baby's leg, they automatically go back. So that all muscle activity. Then respiratory, here it's not mean that respiratory rate, respiratory effort we have to check here. So this is the 5 things we have to discuss. In APGAR score system, there is a point will be there based on the baby's appearance. So the first one is based on the baby's condition, there is a point system. So this APGAR score has to be assessed within 1 minute and within 5 minutes. So first one is appearance. In that appearance, if the baby color the fully in bluish, that is the cyanosed, so the score will be 0 point. If the baby extremities only bluish discoloration, that is the acrocyanosis, so during that time have to give only 1 point. Then baby color fully pink, so you have to give 2 points. Then pulse, if there is no pulse, so the point will be 0. If the pulse rate is 100 beats per minute less than, so the score will be 1 point. The heart rate is more than 100 beats per minute, the score will be 2 point. Then grimace, so here there is no responses whatever we are doing over the baby. Suppose we tap the sole, flicking of the soles, there is no responses. So during that time 0 point. So when we are inserting any suction tube, during that time only the baby get to react. After that the baby has to be quiet. So during that time you have to give 1 point. Then when we are the baby is very active when we are sneezing, coughing and all good. When we are inserting the oropharynx, nasopharynx, suctioning and all. So during that time we have to give 2 point. Then activity. So muscle tones we have to check, there is no muscle movement. So during that time 0 point. Suppose if we flex the baby's arm and legs, when we are it is in slow in progress. So during that time we have to give 1 point. So it's very active. When we are pulling the baby's leg, automatically suddenly it go back. So during that time that is a 2 point. So here the respiration effort we have to see. There is no respiratory effort, there is no proper cry, so point will be 0. Then the baby is having weak or slow cry, the point will be 1 point. Then the baby is having vigorous and strong cry, then the point is 2. So here they have mentioned the score. The normal score is 7 to 10. So within 1 minute, within 5 minutes, the score will be same. So if it is same means the babies don't have any any medical illness, so the baby is in good conditions, the baby do not require any medical interventions. Then next one, moderately depressed, the score will be 4 to 6. So the baby needs suppose any oxygen or any skin to skin care, kangaroo mother care, like that. Then the essential newborn care has to give to the moderate depressed baby, not only for moderate depressed, for every child we have to give essential newborn care. So moderately depressed is we should monitor the baby for few hours. Then severely depressed, immediately we start for resuscitation. 0 to 3 minutes, 0 to 3 is the score. So within 1 minute we have to start the resuscitation. So this is the APGAR score. So here the APGAR score chart will be there. Heart rate, respiratory effort, muscle tone, reflex. Reflex is the grimace, then color. So based on that, 0, 1, 2, heart rate is, there is no heart rate absent. If it is below 100, you give a 1 point. Then over 100 means 2 point. Respiratory effort, I already told you, that is not a respiratory rate, that is a respiratory effort. There is no respiration, so absent means 0. If it is slow, irregular, that is a cry, weak cry, it is there, 1 point. Then good crying means that is a 2 point. Then muscle tone, limbs. Uh, when we are pulling the limbs and it is going back too early means there is no activity in the muscle tone, means you have to give 0 points. Then some flexion, so flexion little bit is there means 1 point. Then active motion, when we are pulling back and automatically it is going to the flexion, so that time you have to give 2 points. Then reflex, no response means 0. Grimace means when we are inserting the suction tube, during that time the baby react, so that time give a 1 point. Then cough and sneeze, when we are baby is having good cough and sneeze when we are putting oral and naso pharynx suction. Then color, blue pale means 0, the body pink, extremities blue means 1, then completely pink means 2. So this is the normal score. 7 to 10 is the normal, 4 to 6 is moderately depressed, then 0 to 3 need immediate resuscitation. Hope you understood about the APGAR score. So this video is basically made for our college student. If any doubt in this, please drop it in the comment box. Thank you. Read smartly, write smartly, be smart nurse. Thank you.